Hello, hello. Welcome back
Good
to
morning.
our May Table Talk. I'm Art, part of your PEI team.
I'm Marissa, also with PEI.
And today we have a special guest. We're privileged to have our guest back, Mr. Richard. You want to introduce yourself?
Yeah, my name is Richard Garcia. I'm a licensed clinical social worker here at Indian Health.
Nice. And as
Hello,
you can
everybody.
see, we have an awesome different platform today. We're kind of in person doing this.
We're in person. We're trying out a new avenue here, but let's go. Let's dive right in. May is Mental Health Awareness Month.
Mhm.
So we brought out the specialist here, Mr. Richard, and we just wanted to dive right in, right?
Yeah. So, what is mental health? We have our own kind of way of explaining it. It's good to hear, from someone professional who deals and helps these clients out on what is mental health.
Okay, well, I can give you like the standard definition. Mental health and what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. So mental health is important at every stage of life, from childhood, adolescence, through adulthood. Um, and again, that's just the term that I looked up on mentalhealth.gov. But to me, mental health is any stressor you may be going through, anything that is worrying you over an extended amount of time, maybe a week, well, maybe over 2 weeks. Usually, when we diagnose someone, they have to meet a certain criteria. You got to be experiencing these stressors over a couple of weeks or so. Because sometimes we have life stressors that we can work out or we can fix. So it's just maybe a couple of days or so. But anything that goes past a couple of weeks, maybe something to be concerned about and to try and seek out some help. To try and figure it out. Doesn't mean if you walk into our clinic or into a mental health office that they're going to right away diagnose you with a mental health disorder. It just means that you're going through something, and then we do an intake assessment, and then we see where you're at with that need or what is going on in your life that we can help with. But again, it doesn't necessarily mean that you're mentally ill or that we diagnose you with a mental health disorder.
So, can anybody have a mental illness, or is that a diagnosable illness?
Well, again, like term here. So over the course of your life, you may experience mental health problems. Your thinking, mood, and behavior can be affected by this.
Yeah.
There are many factors that contribute to mental health problems, including biological factors such as genes or brain chemistry, right? Life experiences such as history of trauma or abuse, and that doesn't necessarily always mean in childhood. We can experience those things throughout life at different stages, or unfortunately for some of us, all through. And then also family history of mental health problems, either diagnosed or undiagnosed. I talk to people and I say, well, no, we don't have any history of that. I said, well, are there any people in your family that are peculiar or always angry all the time? Oh, yeah, okay, but yeah. So again, just kind of looking at those things, and then to be aware that there are also warning signs, of mental health problems, whether examples eating or sleeping too much, pulling away from people and activities and things that we enjoy, right? Also having little or no energy to do anything, and then feeling numb or like nothing matters to me. So again, there's we could go all day with a laundry list of things that would give us this we'll call red flag, or warning that, well, maybe I might need some help with that.
So that one led us into our next question: the cause of mental illness. Can you break it down a little bit? Has COVID? I'm using COVID because we still haven't moved out of COVID, right? We're still here. Has that contributed or put more stress on people that has caused more mental illness, or what other stressors or other causes can cause some mental illness?
Okay. Well, yeah, take COVID, for example. Well, pretty terrifying, to know that there's a flu or a virus out there that is killing people, right out the gate, right? So a lot of fear, anxiety, worry, even some paranoia. But there's such a thing as real paranoia that I don't want anybody to be around me because I don't know if you're infected or you
Yeah,
have it,
yeah.
and it doesn't discriminate, right?
Right,
It doesn't
for sure.
discriminate. It goes after everyone. So yeah, it can cause social anxiety, paranoia, isolation, fear, depression.
I mean, we can
Um,
even just go as far as yesterday's incident that happened with the shooting in Texas. Just like
mhm.
all those fears again are starting to rise. People are starting to get more anxiety. It's just when those become issues later on, 3, 4, 6 months from now.
Right. And when these things come up, fear, paranoia, anxiety, they can manifest into very aggressive and sometimes violent types of behaviors,
Right.
reactions to those things. Because at some point, then we may lose track of what is real and what's not,
Mhm.
and then that was they're like they're called psychotic episodes. So when those
Mm.
occur, well, then that's a reality.
Yeah.
You can tell me, oh no, Richard, that's not true. You're tripping. That's not happening. To me, it is, and it's real.
Yeah.
And it may be frightening me, scaring me, or telling me that I
Mhm.
need to do something about it.
Yeah.
And probably not anything nice. Usually, when those things come up, they're usually more towards violent types of behaviors, reactions, because we're battling against it. We have this sense that this isn't real, but yeah, it is. So we go back and forth until a point where you're just convinced. So yeah, very important to know when you're not feeling right, because once you get to that point, then it's really hard to bounce back.
Mhm.
Really hard to bounce back.
Yeah, we even do some statistics. Weren't we saying that? How long does it take for someone to get help when they're
Yeah,
Mhm.
it's
diagnosed with
years. We're talking a little bit about anxiety. When anxiety develops, it takes up to 10 years for them to seek out
Mhm.
help, and by that time,
we're already self-medicating?
yeah, we're
We're already,
self-medicating.
you
We're,
know,
we're we're having more episodes of depression, depressed, right? So yeah, like we talked about, by that time they're already at a higher state, and not that it can't help or not that you can't help them, but it's just tougher, right?
Mhm.
Yeah. And there's some facts right here too. Mental health problems are actually very common. In 2020, 1 in 5 American adults experience a mental health issue. 1 in 6 young people experience a major depressive episode. 1 in 20 Americans lived with a serious mental illness, such as schizophrenia, bipolar, or major depression. Also, suicide is a leading cause of death in the United States. In fact, it was the second leading cause of death for people ages 10 to 24. It accounted for the loss of more than 45,000 American lives in 2020, nearly doubling the number of lives lost in homicide. So, mental illness can, push people to the point where, they don't want to be here anymore.
Yeah.
They don't want to be here. And that's why, again, important to get help when you start to feel that way. I
Mhm.
tell people, when people are actively suicidal or they do, unfortunately, commit suicide, it's not that they don't want to live anymore. They don't want to live with the pain. They just don't know how to get rid of it.
So
Don't know how
let's
to
go
get rid
back
of
to
it.
another topic that you talked about, some warning signs. If
Mhm.
we do a lot of outreach here, but like if I'm on a Saturday night partying with my buddies or my friends, family, could we talk about some warning signs that I might be able to help and pick up on somebody? I know you talked a little bit about it.
Right. Well, some of the warning signs, having unexplained aches or pains, they're considered like somatic types of symptoms where, my stomach hurts and it's killing me, or
Yeah.
I'm vomiting. Some people pass out or experience this unsteady gait. They fall over. They go to a medical doctor, and the medical doctor says, well, yeah, there's nothing medically wrong with you.
Mhm.
Probably need to go to see someone in behavioral health. Because again, it's just they're called somatic symptoms, and they're related to anxiety, depression, maybe the onset of some other type of mental health problem, and then also feeling helpless, hopeless, uh, mood swings. I mean, and I'm talking about severe mood swings. Where
Mhm.
you're destroying property, or you're slamming door, or just something that's really over the top. We get angry that can't, you can't teach anybody not to be angry. You come and say, I don't want to be angry anymore. Well, yeah, I can't help you with that, but can help with the level of angry, based on where your mood's at, where that level's at. And then we work on trying to decrease it, and usually it just involves, some form of therapy, cognitive behavioral therapy, where basically that's just trying to restructure our thought process, to rethink things before we react, to come up with a plan of action. We react, and then there's action and reaction. So, we try to focus on not to just react, come up with a plan. But in order to do that, we have to rewire that thought process, because we go from 0 to 100. We're already in the fight mode. We don't give ourselves time to process what we're experiencing, because usually part of past trauma.
Right.
Right. So then, other things that could happen is that we hear voices. Sometimes people just hear whispers, or somebody just called my name. Dude. Oh, it's nothing. Whispers. Usually that's how it starts off. When we're having that type of psychotic episode, usually it's whispers, and then we'll hear chattering and things like that. Just things that we think are unusual, but then we just kind of shrug them off. So those can be possible warning signs. And then, and then thoughts about harming yourself. I don't want to be here anymore.
You talked a little bit about going from 0 to 100. I was reading an article the other day in Old Town, by where I live. They had a road rage incident. He stabbed the guy. I don't know what happened, but the guy stabbed the other guy over a parking lot like 11 times in the head.
Wow.
Right? I think about that because you talked about sometimes the therapy, how to handle that, how to deal with that. I think a lot of us, I know I've gotten caught up where I get angry, right? If I get cut off, or somebody, especially if they give you the finger, right? I don't know, that does agitate it, but learning that therapy or how you talked about it, how to cope with it, is important.
Yeah, very important to understand. Not why, but how did this evolve? How did I get from just being angry to that's rage? That's different than anger. Anger and rage are two different things. and again, because what happens, I tell people, think about from the time that you're a child, and depending on the environment you grow up in, the house you grow up in, well, we're always talked at and not to. So when we're talked at, and based on the tone of our parents' voice and what is going on, well, something happens with the brain. The front part of the brain, the frontal cortex, has this like alarm when we feel something bad's going to happen, or we're uncomfortable, right? So then it sends a signal to the back part of the brain called the amygdala, where it's either fight, flight, or freeze. So when we're a child, most of the time we're either going to freeze or run, and try and hide or whatever. But very rarely we fight back. Very rarely fight back. So then, our startle response is out of whack. We don't know how to think because we're not given the opportunity to, because you're screaming and yelling at me. So I don't have very many options, And as we get older, well, then we see things that are going on in our home or wherever in the neighborhood, and we learn that, wow, if I just punch you one, then you'll stop. Right. Or if I put a knife in you, you won't mess with me anymore. So then again, then they gradually just over time, and then it really gets out of control. But how do we know that? Because we normalize those things as we go through life. We say, well, that's what I got to do. You got to be tough to live on the res. You want to survive. You got to know how to kick butt. If not, you can't go to the store. You can't go to the park. But yeah, you see, how we say that's true. But is it true? Do we have to be violent towards other people to live here, to survive? Not really. But how do you tell someone that when that's all they know?
Right.
But I think that's it anywhere, not just here. I think a lot of places are that way.
Oh yeah, I grew up in Nevada, in LA, man.
Yeah.
That's all my dad used to say. Man, you're gonna fight. You're gonna fight. You don't have a choice. You don't have a choice.
So, getting help is important.
Absolutely.
But before we talk about that, I would love for you, or maybe the team could come up and talk about some positive coping skills that maybe we could go over like in a minute or two to help somebody deal with a situation. Let's say they can't get in right now to see Mr. Richard because Richard is booked out, and something that we could give their viewers or somebody out there that we could help them some positive coping skills.
Well, one thing I like that me and George were talking about was peer support. Those peer
Yeah, peer counseling,
advocates who, you can call, they can
Yeah.
kind of coach you through it, maybe what worked for them, maybe some helpful tips. Because, it's really empowering to hear someone go through the same situations you did and maybe what worked for them, hearing their story, maybe that'll help you. So I feel like peer support is just an important thing to have
Yeah,
while
yeah.
you're in this stage of waiting for appointment to
Yes,
get
yes.
seen.
Right. Yeah. And there, when you do talk to the therapist or even like an access and crisis line, they may tell you to try and do some deep breathing exercises. To be able to just say, okay, well, slow yourself down, breathe, because a lot of times when we're angry or we're hurt, like even if I hit my foot or we don't breathe right. We usually hold our breath, or
Yeah.
when you're starting to piss me off, I'm just because I'm trying, but that usually doesn't work. You got to breathe. Your brain needs oxygen. You need to breathe. And while you're breathing, it's supposed to provide a calming effect. The FBI teaches their agents to use it to beat a polygraph, to be able to calm the body and the mind. So over time, it works. When I first tried it, I was like, man, this ain't gonna work. Man, who's doing this? But you got to practice. You got to, it's really, it can be a quick fix for some, and then for others, it may take a minute. It may take a minute. You can't. Again, it depends on how much duress that you're in. If you're in a lot, then I recommend the access and crisis line to call. Like you said, if you can't get a hold of anybody at the clinic, then you call the access and crisis line. Talk to somebody, and and just remember, they don't know you. They don't know who you are. So you don't have to be afraid that, oh man, they're going to tell everybody or whatever. It's just a person who's trained to be able to walk you through it. Sure. There's that, and then I tell people, well, why are you angry? What is it that you're angry about? Well, my kid, he broke a glass on the floor, and when I did that when I was a kid, I would get whipped for that. Just the thought that I wanted to whip him, but I didn't want to, so I yelled at him. I got angry with him, and I scared the crap out of him. And I feel bad about that. I don't want to do that. So how do I stop doing that? Right? And again, it's about rewiring that thought. Well, I can get away with it when I was a kid, but yet, I thought, okay, I'm doing something different. I didn't whip him. I'm yelling at him. But it kind of has the same effect. So then we just work on rethinking it to talk about, well, yeah, when you were a kid, you got whipped for holding a glass. But why give a kid a glass? Because I'm a kid, I'm gonna drop it.
Right.
To rethink how we do things and how we go about it. Like, okay, well, in the future, I won't give a 2-year-old a glass or a 3-year-old a glass. Maybe a sippy cup.
Right.
And then to not focus on that, I never got away with anything when I was a kid. I got beat for it, or I was whipped, or that was my punishment. But it made me stronger. That's not true. That's what we were taught and what we believe. So it's going through those things and picking it apart to see that, well, maybe a lot of the stuff that I was taught, I believe, is not real or true. It was just used to justify the punishment or what was happening to me at the time. Because we cannot undo the things that have happened to us, but we can definitely work through them as best as we can. You can't help anybody take away trauma. It's there. But when it pops up, then you'll have those ability, those skills, and your thoughts will over time rewire themselves to it's not as intense. And then we don't continue to pass it on, from one generation to the next. So yeah,
I like that.
Very important.
We have a question. What if you're afraid someone will see you seeking therapy?
Well, that's real, right? Okay, then what is that fear that they're going to tell everybody? Because my thought is, if I'm going to seek therapy, it's so that I can get better, and then maybe a big part of what I do is when people come in, they say that, well, I know this person here, and I think they saw me, and I was like, okay, well, what is that about? What are you afraid of? Well, they're going to tell everybody that I'm mentally ill. So we work on self-confidence to be able to say, well, think about it. Look at all the things you've been through in your life. And that's one of your fears, that you're afraid someone's going to tell someone that you're getting help. Well, they're not going to tell me. They're going to say I'm crazy or something's wrong. I said,
Would they rather see you suffer than get
well,
help,
or maybe they are a person who's always talking negative about you.
Right.
So, but look at that. That's one of my fears, and it's real.
Yeah.
It's real. I don't ever take anybody's feelings or thoughts away from them. I just walk them through it. I walk alongside them. It's not my job to convince them that, oh no, that's all in your head, because that's not fair.
Right.
Yeah.
That's not fair. So I just say, yeah,
So-
you're right. You're right.
So I know
It's worth it.
one option, Richard, and I don't want to speak for you, but I know because of COVID, you guys have gone a lot to virtual visits,
Mhm.
right? That could be an option if they don't feel comfortable coming in, or that stigma associated with being seen at a health facility for behavioral health.
Right. Yeah. And like I said, this thing about, people talking about us or, talking bad about my family. Well, when I looked at my own family, I thought, wow, we're not very nice people, so I'm sure people have been talking about my family for generations, in a negative way or whatever. So am I really going to worry about,
Right.
this other thing? That feeling's real and all, but if I look at my family, well, there's a lot more other things to talk about than me going to get mental health treatment.
Mm.
So again, it's just working through that fear to overcome it, because we have a lot of strengths within us that we can use to be able to say, okay, well, at the end of the day, I really don't care what anyone thinks, because I feel better about me.
Right.
Yeah.
I feel better about me.
For sure.
And they, like I said, if there's a million other things they can talk about me about, other than mental health treatment.
Mm-hmm. Definitely.
It's like any wellness, getting help. I mean, we should feel better, positive about them, but sometimes I know we've always talked about the stigma associated with it,
Oh yeah.
right?
Oh yeah, and that's real. Like I said, I don't take that away from anybody.
Yeah.
Those feelings, those emotions are real, and usually that's kind of one of the first things that we talk about when we do the assessment. Well, who's going to know that I'm here? Who has access to my record?
Mhm.
Those kind of things. So I run it down to them. But yeah, that those fears are real, but should never be a reason why we shouldn't.
Stop you from getting help.
Yeah.
So let's talk about help. Help is important, Richard. I know you cover a little bit. How you talked about different kind of treatments. How can I get help? How can I get through those doors? How can I virtually call my provider or call? We're going to talk about resources, a crisis and access hotline.
Mm-hmm.
Right. So when someone calls out, well, then that means there's an immediate thing going on that then you need help with. Whether you're having suicidal thoughts or feeling depressed, to where you just can't get out of the house or get up. So then we assess those things and walk you through the process of what can be done to help you at that point. And again, everything's confidential, but also you got to let people know that, if you're telling me you're going to kill yourself and I can't talk you down, then it's my duty to get you help.
Yeah.
To get you help. It's just, as a human being and as a clinician, I'm not going to just say, okay, well, you're telling me you're going to blow your brains out. Have a good day.
Mhm.
I try to talk you down, but you don't want to do it. So bye. That's not how it works.
Mm.
That's not how it works. But yeah, you access the crisis line, and if you're not comfortable about coming into the clinic, then you can call. And right now is a good time because we're doing virtual telephone appointments, and
Mhm.
you can get a feel for what it's like. The first thing that happens is we do an intake assessment. Just ask you general questions, just to see where you're at, and then what it is that is presenting that we can work with. And then I find that a big part of it is just getting familiar with the therapist. If you feel like you click with this therapist, then good. If not, well, then you can ask for another one. You can ask for another one. But just that part, just the intake assessment will hopefully help you to get a sense of what's going on and how it works. And then usually the therapist will tell you, are you comfortable with a male or a female therapist? So we can make sure, again, because this is not about us, it's about you, to be able to make you feel comfortable so you can continue to come in and get the services. And again, not my job to make you think one way or the other. I just walk alongside you. We just take the journey together. And wherever we go, that's where we go.
Mm-hmm.
So talking about this, you're talking about help, and I've heard this said to me, and sometimes maybe I don't understand, where they say my parents or my mom or my dad are depressed, but they don't know that they're depressed.
Mm.
Can that happen?
Oh yeah, absolutely. Yeah.
Right? They just pick up on warning signs, like you talked about earlier, right?
Yeah, and we were all kids once, and that's one of the things I tell parents too. Don't forget you're ever a kid, but children are pretty insightful. They know things, they see things that adults don't. And I don't remember when we were a kid and we thought we weren't allowed though.
Mhm.
Shut up. You know what you're talking about, or depressed. What? There's no such thing.
Yeah.
So yeah, pretty hard when you see that your parents are struggling with whatever that is, and you want them to get help. In large part because it affects us as children.
For sure.
You
I
know,
think PEI, we do a pretty good job trying to, always, say those signs and symptoms, what to
Mhm.
notice, what the
Right.
red flags are. I know with Mental Health Awareness Month this month, we have been doing some mental health first aid as a resource that, if you want to get more information, we offer mental health first aid classes. QPR, which is the question, persuade, refer, which is presentation we do on suicide. So, if you guys want to schedule a class for us to come out and teach, definitely let us know and reach out. But there are some resources here that can help assist, with those signs and symptoms and red flags. We try and do a lot of outreach with that. So, definitely reach out if you guys are ever interested in some more information.
Right. And if you do have family members that are struggling, then you can come and see us for that too. Yeah, because then again, like I said, we walk you through it and help you to help them as best as you can.
Mhm.
So they call the front desk, make an appointment. If I wanted to bring my brother or my mom in, could I come in with them to do that initial handoff, or
Absolutely.
what would you suggest?
Absolutely. It's your time. If you're okay with it, and you don't have an issue with confidentiality or whatever, then fine. Yeah, a lot of people do.
Yeah.
They come with someone, to get that support. And then usually like mid through it, I'll say, okay, are you feeling comfortable? Would you like, your mom or your brother or whatever to step out so we can continue? It's up to them.
Yeah.
Not for me to tell anyone they can't bring anybody. The more the merrier to me.
Yeah, for sure.
So on a virtual visit, do they have to do the intake in person, or can they do it virtually?
Do it virtually. You can do it virtually.
That's awesome.
Mhm.
That's an option, right? If they don't want to
Option.
come in
Yeah,
because
option.
of the negativity, the stigma, they can call up,
Mhm.
set that virtual intake, and then
Also
Yeah.
over the phone too, right?
Yeah.
You
Oh,
guys
yeah.
do just
Too.
over
On the
phone.
telephone.
Mhm.
I kind of like virtual for the first one, but again, not up to me to decide.
yeah.
Whatever they're comfortable with, and we just go with it. Because I figure if it were me and I don't know you, I got to get to know you first.
Right.
And that's a big part of my therapeutic process, that give people time to get to know me.
Mhm.
I wouldn't expect anyone just to start telling me things. Well, I don't know you, man.
Right.
So yeah, to develop that relationship and
Mhm.
to see where it goes. You know what I mean? And then as we do that, then we start getting into those things. We start building that foundation for trust and mutual respect, all those things, culture, all that.
Right.
So behavioral health hotline is on there, 760-749-1410. Option 4, Richard, we're closing up. Any final quotes, comments, anything you want to leave? Your personal home number, so you can call. No, I'm only kidding. Anything you want to close with us?
Well, I tell people you are who you are. It's beautiful. Don't ever change that. It's just these things we talked about, those stressors. They can potentially lead to some serious mental health problems in the future. It's not really necessary, but I understand and I respect it to overcome the stigma, the fear of that. Somebody works here that knows me, or somebody sees me walking through that door. But give it a chance. Give it a chance. And if you don't like what we're given, then it's up to you to decide if you want to come back.
Agreed.
Mr. Richard, thank you again for blessing us with some awesome information and knowledge.
Yes.
That wraps up our Mental Health Awareness Month. What's next month's topic?
It is what is it?
Elder
Summer?
safety.
Elder safety.
Elder safety, which we could wrap behavioral health around all of it, right? Thank you for tuning in. We'll see you guys next month.
Next table talk.
Next table talk. Thank you, Richard.
Thank you.
Thank you,
My
guys.
pleasure.
Thank you.